I'm so excited. Today I have new information to share for people who have PMR. PMR stands for polymyalgia rheumatica, and this disease is really common in people of European descent who are over the age of 50. It's the second most common rheumatic disease in that population after rheumatoid arthritis. So it's really common. And I have really exciting news to share because before now, there have been no alternatives to prednisone that may help improve your ability to go into remission, besides prednisone and Kevzara or Actemra. And so this is a new, potentially natural remedy that can help. And it is called, dun, dun, dun. Okay, I'll tell you in a second. Actually, what I'm going to do is tell you about the study. This study was done on 29 people with PMR. And of those 29, they were taking prednisone, but did not have giant cell arteritis. And they tested them to make sure that they had inflammation, ESR and CRP, all of these blood tests. And then they were allowed to take prednisone, and the average dose that they were taking was somewhere around 15 plus or minus 7 milligrams of prednisone per day. And then the last thing they tested is the most important thing of all. It is, oops, let's make that less bright. Okay. What they found is that the prednisone, people who are reliant on prednisone, taking it for PMR, the people who got into remission the fastest were people who took vitamin D. Nobody was taking vitamin D before the study started. Prednisone for GP vasculitis, thankfully, I've tapered to 5 milligrams. CRP is dropping. Yes, wonderful for you. Okay, so in this study, they found that everyone whose blood was tested for vitamin D levels, it's called the 25-hydroxy vitamin D. The average was 10 nanograms per milliliter, and that's pretty low. The normal is somewhere between like 40 and 70. And then it's still safe below 100. So anywhere between 40 and 100 is a good range of vitamin D. But in this study, the average person diagnosed with PMR taking prednisone was around 20. And that's really low. So they told these people and their doctors to take vitamin D to see if that would help them get into remission. And they found that those who were able to go from 20 up to 40 with the vitamin D levels had the fastest recovery from PMR. That is amazing. Like, this is breaking news. It was published this week. August 29th was the day it was published. And they were shown that those whose vitamin D level went from 20 to 40 within 3 months, that their remission was 3 times faster than, their chance of remission was 3 times greater than those who didn't quite get up to 40 within that time period. So the takeaway from this is that people who have PMR are taking prednisone, need to be supplementing and getting their vitamin D levels up above 40. And so what can you do? What should you do about this? Well, one of the takeaways for me is that everybody who was in this part of the study was taking prednisone. And when they compared them to otherwise healthy people of the same age and demographic description who weren't taking prednisone, who didn't have PMR, that they were more likely to have low vitamin D. And so was it the prednisone causing that? Probably. There's evidence in other studies and other diseases that prednisone causes low vitamin D, in addition to low calcium. So not just for decreasing your remission risk, but in addition to improve your chance of not getting osteoporosis from prednisone, you need to be following the guidelines that the rheumatologists recommend of taking calcium, vitamin D, quitting smoking, stopping alcohol, and getting exercise. And that's the way you can do the best after taking prednisone for PMR to prevent osteoporosis. And a super easy way to get the calcium and vitamin D that the doctors recommend is by taking Nutranize Zone. I invented this. It's a first and only supplement for people on prednisone. It's got a morning and a bedtime bottle, and it's a month's supply of everything you need. And you can get it at Nutranize.com. And it helps you feel like yourself again while on prednisone. So just go there and get that. And then you can help put yourself into the right place with replenishing the nutrients that prednisone depletes, and hopefully improving your chance at remission if you have PMR. Signing off is Dr. Megan, your prednisone pharmacist.